Hello, I'm Dr. Karen Kelly, a registered nurse and president of the Illinois Nurses Association. I'm proud to introduce INA's video series about the Affordable Care Act, which will explain the Affordable Care Act's impact on Americans in general and Illinois residents specifically. With the recent Supreme Court ruling, everyone should understand the benefits of the Affordable Care Act, which I'm going to call the ACA from here on out, both for individuals and the healthcare delivery system. The new healthcare law prohibits insurance companies from ending coverage if someone gets sick, billing citizens into bankruptcy because of an annual or lifetime limit, or soon, discriminating against anyone with a pre-existing condition. For example, cancer is an illness that affects many, many families. A child who's been successfully treated for cancer grows up to be an adult who cannot obtain affordable health care insurance outside of a group plan, even though that child was cured of cancer 20 or 30 years ago, because cancer is considered a pre-existing condition. Currently, a diabetic who changes jobs may be eligible for insurance through the new employer, but the insurer can legally refuse to cover care that's related to diabetes, even routine care to maintain the highest level of health for this individual for at least the first 2 years of coverage. In 2014, the law will ensure that all have access to health care benefits despite chronic or prior illnesses. These changes will help stop many of the nation's bankruptcies, since about 50% of all bankruptcies are the result of health care expenses. Americans will not lose coverage if they're laid off or change jobs. Insurance companies must now cover preventive care like mammograms and other cancer screenings. The new law will increase funding available to the 534 community health centers in Illinois that promote public health, prevent disease, and protect against public health emergencies. Two key provisions of the Act are designed to help families and children afford basic primary care and acute health care services. The first provision, the mandate provision that we've heard so much about, is the requirement that everyone purchase insurance or pay a penalty beginning in 2014. The mandate doesn't say that buying insurance is unlawful. It says you can either buy it or pay a tax, as this was described by the Supreme Court. You can either purchase your own insurance with or without government assistance provided for in the law, or you pay a tax to help defray the taxpayer's burden of paying for your care when you need care in the future. For decades, the cost of care for those without insurance has been borne by those of us who have health care insurance, in a process known as cost shifting. Through cost shifting, the unreimbursed, unpaid cost of care for those who have no insurance coverages is added on to the cost of those who do have insurance. The second major provision extends health care through an expansion of Medicaid eligibility to everyone at or below 133% of the federal poverty level. The law's Medicaid expansion was written so that states would lose their existing Medicaid federal matching grants for not complying with these federal requirements to expand Medicaid to all individuals at or below 133% of poverty level. States that did comply would receive 100% of the extra funds needed to cover this larger population. This federal subsidy would gradually reduce to 90% by 2017. However, the Supreme Court ruling said that the federal government could offer the money in exchange for states expanding its Medicaid rules under federal parameters, but states are not required to accept the offer, basically creating an opt-in provision for the states. There are leaders in some states who, at least for now, propose to refuse money on political principle. Residents in those states who would have been eligible for the expanded Medicaid program might then have to either get federal individual subsidies to buy their insurance or apply for a hardship waiver to avoid having to buy insurance at all. Both are provided for in other parts of the Affordable Care Act. This refusal of funding by some states will hurt the most vulnerable in our nation: the poor, the disabled, and the elderly. The nursing profession has long recognized the need for health care reform. A coalition of nursing and healthcare organizations and consumer organizations, led by the American Nurses Association, published a plan for healthcare reform in the early 1990s. Many of those concepts are integrated into the Affordable Care Act. In the second video, find out how the ACA will affect registered nurses. I'm Dr. Karen Kelly, a registered nurse and president of the Illinois Nurses Association.